Welcome everybody to everything you always wanted to know about health insurance. And this time, it's all about PPOs.
It's the second piece of our trilogy.
Yeah, like Lord of the Rings.
But no elves.
No. This is the Midwest Public Risk Health Benefits story.
Catchy title. Oh, wow. Okay, let's get started. This segment is about PPOs.
Preferred Provider Organizations. But we call ours the Open Access Plus plans now. Then there are HMOs.
Health Maintenance Organizations.
And CDHPs.
Consumer-directed health plans, but we call ours the Choice Fund.
Tune in for that in the next video. In MPR's 3 health insurance options, Humana manages the HMO, but it's only available in the Kansas City area and surrounding counties. Cigna manages the Open Access Plus plans and the Choice Fund, our CDHP.
What's the biggest difference between the 3 plans?
Well, there are a lot of differences.
No. What's the biggest difference?
In Cigna's Open Access Plus plan, you can go to doctors outside the Cigna network and get some kind of benefit. Not as much as for doctors who are in the network, but something. And that's true in the Choice Fund too. In Humana's HMO, the plan doesn't pay anything if you see a non-network doctor.
And Cigna has doctors and hospitals outside Kansas and Missouri. You can find them on Cigna.com, so you've got coverage when you travel.
Correct, but there's more.
Of course there is. Seems like we said that HMOs don't have a deductible. The Open Access Plus plan is a PPO. Does it have one?
It does, but it has several plan options with a different deductible for each one. And in all of them, there's one amount for individuals, like if it's just you, and another for families.
And copays?
Yep. You only have to pay that fee for office visits, when you see a doctor or have lab work or x-rays done in their office. And there's a copay for emergency rooms and hospitals too.
And does that count towards the...
Toward the deductible? No. But for office visits, that's all you pay, just the copay. Are you going to ask me about coinsurance?
I am now.
Coinsurance is the portion of medical fees you pay after you've met the deductible. Let's say you've had your gallbladder removed as an outpatient.
Let's say I've had my nose fixed.
Well, I think your nose looks fine.
Sure, I've had it fixed.
Really?
No.
Let's say the outpatient surgery costs $2,500. If your coinsurance is 20%, you would pay $500 and your insurance would pay the rest after you've paid the deductible.
So let's say I don't need surgery. Maybe I just have a really bad case of poison ivy and my doctor's office is closed. What if I have to go to the hospital or the ER?
In that case, you might want to consider an urgent care center. You only have to pay a copay there.
What about a quadruple bypass? Would I owe 20% of more than I want to think about?
No, because there's a coinsurance maximum. And there's an out-of-pocket maximum as to how much you have to pay, period, in any plan year. That's from July 1st to June 30th for MPR plans.
But what about prescriptions?
Yeah, lots of details. That's why everyone should check out the MPR or Cigna websites for more information. You can look up what you want to know.
And after you've rested, there's lots more to know about HMOs and CDHPs. Check out the other videos for the rest of the story.